Are you struggling to interpret arterial blood gas results without getting confused? Lab values for bicarbonate can be overwhelming when you are trying to determine the primary cause of an imbalance. Let us simplify the process with one golden rule that works every time. Stop guessing and start analyzing with confidence. In metabolic disorders, the bicarbonate level and the pH always move in the same direction. If the pH is low and the bicarbonate is low, you are looking at metabolic acidosis. Conversely, if both values are high, it indicates metabolic alkalosis. This physiological relationship is the key to identifying metabolic shifts.
Using this rule prevents common misclassifications during rapid clinical assessments. By checking the direction of the bicarbonate relative to the pH, you can quickly confirm a metabolic origin. Remember, if they go the same way, it is metabolic. Apply this consistently to master your nursing exams and bedside practice.